Hello everyone, I am Dr. Anil Kamath. I am a Senior Consultant Surgical Oncologist here at Apollo Hospital, Bannerghatta Road. So let me take this opportunity to talk to you all about stomach cancer. I'll talk to you about various aspects of stomach cancer, what causes it, how does it present, what are the tests which are done, and how is it treated. Now, what causes stomach cancer? Stomach cancer, at least in South India, is among the more common cancers. The distribution varies from country to country, and at least it is more common in India. Now, the exact etiology of stomach cancer is not known. A typical patient is usually an elderly male who has history of smoking. It's not that every time it has to be this way. We see this cancer in younger patients also and in females also. The exact etiology is not known. Smoking is a known etiological factor. Now, apart from this, infection by an organism known as Helicobacter pylori also is known to cause stomach cancer. A small fraction of stomach cancer can be hereditary. How does stomach cancer present? Now, the symptoms of stomach cancer can be quite vague. They are what we refer as upper GI symptoms. Usually the symptoms the patients present with is a sense of bloating after taking food or pain. You must remember that these symptoms can be due to harmless conditions like acid peptic disease. In more severe cases where the tumor causes obstruction, the patient can present with vomiting, and sometimes there can be blood in the vomitus or in the stools. Long-standing stomach cancers produce weight loss and loss of appetite. It is also worth remembering that patients with stomach cancer can be totally asymptomatic, and it can be detected during evaluation of conditions like anemia. So once the diagnosis of stomach cancer is done, the next the test which is done is an upper GI endoscopy. Here a tube is passed through the mouth and the stomach is visualized, and if there is a suspected cancer, biopsy is taken from it and sent to the pathologist. The common type of stomach cancer is what we call an adenocarcinoma. So once the diagnosis is established, the next step is to stage the disease, to see how much it has spread, whether it is confined to the stomach or it has spread elsewhere. For this, we may do various tests like CT scan or MRI, and the test which we prefer nowadays is a PET scan. So at the end of evaluation, first we reach a diagnosis that the patient has stomach cancer, and next we conclude what stage the patient is in, which can be from 1 to 4, 1 being a small early cancer in the stomach and 4 being cancer which has spread to the liver or lungs. Treatment is decided based on this staging. In very early cases, the tumor can even be removed by endoscopic method. In most of the cases, a combined modality of treatment which includes surgery and chemotherapy is used. Especially in stage 3 stomach cancer, we usually start with chemotherapy, give a few cycles of chemotherapy, shrink the tumor, and then take the patient up for surgery. Now, with regard to surgery for stomach cancer, the procedure is called a gastrectomy. So the stomach is removed either partially or totally. So depending on this, we call it either a partial gastrectomy or a total gastrectomy. Along with the stomach, the surrounding lymph nodes and the omentum is also removed. Nowadays, like in any other surgery, this surgery can be done in minimally invasive method. This surgery can be performed both by laparoscopic method and robotic method. So when suitable and when cases are done by laparoscopic or robotic method, the patient experiences less pain, the hospital stay is less, and there are less chances of complications like wound infections. When properly treated, stomach cancer is a curable cancer. Thank you.